Senator Casey, welcome. It is always a pleasure to share this virtual Zoom screen. You'll recall I started here in January 2020. You had me down there for one of your Black History Months, and I think we expected we'd see one another in person more than we have. But this pandemic continues to be a challenge, and you know, that's one of the things I know you and I have talked about is how important 2-in-1 has been during this pandemic. And just revealed its critical need. And I know you're going to talk here about a variety of things that have moved you. And so I'm going to step back here. I'm going to drop off my screen and I'll give you the time. But I did want to just first of all say thank you for taking the time. And I heard that you're going to be in another virtual event in, I think, Erie for 2-in-1 later today. Your commitment to 2-in-1, to human services, which I know from my previous work at Meals on Wheels and your work with aging, it's tireless. And we are fortunate as a state to have you as an advocate for those who are often overlooked and certainly underserved. So thank you. I keep wanting to say Bob, because I feel we're so friendly now. We see each other all the time, but thank you, Senator Casey, for joining us.
Well, Kevin, thanks very much. I want to make sure we get right to questions and have a discussion, but I wanted to start by commending the United Way of Lancaster County and the 5th anniversary of the Pennsylvania 2-in-1 East. The system, the 2-in-1 system in our state has been, to say it's been essential, I think is an understatement for our Commonwealth. And there's still, of course, more work to do to make more and more of our fellow citizens in Pennsylvania aware of 2-in-1 and the value of it. And that's up to all of us, especially those of us that have any kind of a microphone in the public square. We know that when COVID-19 hit in March of 2020, the 2-in-1 system responded with information and referrals to support services. The system was able to point people to places for help, especially personal protective equipment, and all of the challenges that presented. Of course, those challenges went far beyond what governments were doing or not, or what the nonprofit community or the for-profit community were doing. We just had a problem. We weren't producing enough PPE, and that's a larger failure that we can talk about at another time. We're doing some work on that in Washington to try to change that, because we never, ever want to become dependent upon China the way that we were for personal protective equipment. That's a real area of concern for me, and it really angers me that we didn't have a system in place to provide PPE. But there's no question that 2-in-1 mitigated that problem that so many communities faced, no matter where you lived or what your station in life was. In 2021, the United Way of Lancaster County 2-in-1 call service alone answered more than 40,000 contacts, many of which helped address needs directly related to COVID-19. Now residents in every county in the Commonwealth can access 2-in-1 services. But they're not just for pandemics, of course. 2-in-1 can help a family find childcare or housing information, so much else that 2-in-1 does. So we're grateful for all the work that's already taken place. I know that, Kevin, you were one of the people that helped me better understand the need to introduce specific legislation, the so-called HELP Act, the Human Services Emergency Logistics Program, and that's the long way of describing the HELP Act. This act would provide grants to 2-in-1 systems throughout the country to ensure comprehensive coverage with up-to-date information about mental health, substance use, housing, childcare, and so many other human services. Sometimes the biggest problem the biggest problem for most citizens is just getting the right information, talking to the right person, having the right phone number, having the right contact information. And 2-in-1 helps people in emergencies when they need information to get answers, to get help, to get the kind of information that all of us should have a right to expect. So it's a much better, more efficient link for families in need of these services. So thanks for all you do, and thanks for giving me this chance to chat with you today, but let's open it up.
So I'm going to start. We'll ask you a couple questions, and then we'll see what we've got here in the chat. But so the first question I've got here is, with increased funding in 211, what role do you think the system will continue to play in diverting non-emergency calls to service agencies that do not require police? This is some of what the HELP Act is about, right? Can you help us understand what we're trying to do and how we're not trying to harm the system, but improve it?
Well, I think because of failures at the public policy level, federal, state, and local, we have not set up enough, have not set up a system that allows communities to deal with these circumstances that don't involve or shouldn't involve law enforcement playing the predominant role. There's no question that when someone is posing a direct danger to another human being, you might need the help of law enforcement. But there are so many instances where law enforcement is called because that's what everyone's been doing for so many generations. And often you don't have the help that you need at that scene. And that's what we're trying to do, to make sure that we can help the community, help the individual, and certainly help law enforcement get the right expertise on the scene, the right help at the right time. So if you wanted to kind of break it down into three basic areas, this investment in 211 would, number one, make it possible for the system to be available across the country. So there's uniformity across the country, not a patchwork. That's a recipe for further problems. Secondly, the more funding, more investment would provide for staff who can help keep the listing of available services up to date in real time, because that requires human beings to provide updates to make sure that the data is accurate and reliable. And then thirdly, the additional funding would make it possible to coordinate with service providers and other hotlines, such as the suicide prevention hotline, just to mention one example. So families would be able to be linked to housing services, childcare, healthcare, like I mentioned before. But we can also reduce the burden on law enforcement. Law enforcement should not be called in every instance where someone might need help, but they're not posing a danger to others, and they need the help that we can provide them. The good news is we have a lot of capable folks out there who have an enormous reservoir of expertise that we're not tapping, so that we don't have these tragic situations where you have an encounter in a community that leads to someone being killed, when sometimes all they would have needed would have been the help of a mental health professional or some other professional on the scene. So that's one of the reasons why we've got to make sure that we provide more funding. But look, in Washington, there's always plenty of support for funding for certain priorities, right? The defense bill usually increases every year. The tax code has been rigged for 40 years, is my view, and it's a well-informed view. The tax code has been rigged for 40 years for very wealthy Americans and very powerful corporations. That's just a fact.
Right.
And anyone who denies that is either lying or they're just not very well informed. So if we want to turn that around, and the American Rescue Plan was one of the few instances in those 40 years where we said we're going to focus dollars, big dollars, on priorities like helping families raise their children. That's what the child tax credit enhancement was all about. And if we're serious about these circumstances that I just outlined, we're going to make sure that we have more investment in 211.
So you mentioned right there the American Rescue Plan, and I appreciate that. We here at 211, we, of course, our top priority, or I should say our top issue that we respond to, is housing. And we've got a question here I'm going to ask. But before I get to that, talk to me a little bit about the American Rescue Plan and its intention. There's a lot of communities that haven't spent their dollars yet. some feel that the guidance is a little too scant. I mean, what is the expectation here? Is it filling budget holes? Is it investments in infrastructure? You talked a little bit about childcare. What's the guy? I mean, I think personally, I'll just state my personal view is this is a once in a generation, possibly 2 generations, as you said, 40 years, opportunity to make transformative decisions that change the game for individuals. But I'm curious, the Washington perspective, what were you all hoping that communities would prioritize?
Well, certainly we're dealing with an emergency. That's why the word rescue is in that bill. This isn't one of those, well, hope we can get it done sometime, some year, some decade, right? It was when the house is on fire, you don't sit on the sidewalk and say, I wonder if we could get this fire out in a couple of weeks. Right. You get the damn fire out. And that's what we did with the rescue plan. That's why we had to get it done quickly in March of 21. Would have been nice to have help on both sides of the aisle. We had zero votes on the other side. But we weren't going to wait around to hold hands for another 6 months or a year to try to get both sides to agree. We got it done. Yes, we rammed it through, and I'm very proud that we rammed it through. Sometimes you got to do that. There's a time for hand-holding and patience and deliberation, waiting for the other side. And then there's other times you just got to get it done, and that's what we did. But if I had to summarize the rescue plan, I could do it in 3 words: families, schools, and vaccinations. The American Rescue Plan is the reason why we went from 2 million vaccinations to 210. It's actually about 212 now. You can't go from 2 million to 212 by talking about it and holding hands. You got to get something done.
You need money for that. We
got lots of vaccinations done. The schools, well, we could have sat around and pointed fingers like some politicians. Those great politicians in Washington were pointing at school districts and teachers and principals and communities saying, open your schools, open up. And they didn't do a damn thing to fund the opening of schools in a safe manner. It's difficult to open a school after a pandemic. It's especially difficult to open it safely. It costs money. So we said, we're going to give schools $130 billion, not $1 million, $1 billion to help open schools. What resulted? The school number went from 46% open for in-person learning to more than 95. I think it's about 98% now. That didn't happen by magic. It happened because of the American Rescue Plan. So far we're batting 1,000. Huge increase in vaccinations, huge increase in schools open. But the other thing we did was we helped families. We've said for the first time I'll just say this, I know it'll offend people in both parties, but really the first time in recent American history where the Congress of the United States on one side of the aisle said, we're gonna provide direct help to families in a big way so that you'll be able to help, you'll get some help in raising your kids. You can pay for gasoline, you can pay for food, you can pay for school activities for your kids that a lot of parents never were able to pay for before. So in Pennsylvania, 2.2 million children benefited from that child tax credit. And each of those families who were benefiting got a little more than $400 a month. And that was a good thing. It was good for the child. It was good for his or her family, but it's good for all of us. That investment alone reduced child poverty by 40%. I
just heard yesterday on NPR, I was listening to a story and they were talking about PPP, which the majority of that ended up going to the top 20% and essentially was regressive. But the rest of the support, what you're talking about, has been really progressive in how it's been helping those families and hasn't been, almost no fraud and those kinds of the people who've had fraud have been prosecuted. But this American Rescue Plan work for us at United Way, this is our focus, right? This is the people and the families who are in that Alice population I know you're familiar with. The question here, and I think it's because we care so much about housing in 2-on-1. I think this is a really important one. We often get calls and do we have resources and organizations doing work, yes, but do we always have the shelter beds and the housing and those things, right? And so the question that Earl asked here is, how can we address the problem of awarding Section 8 vouchers for areas with no available housing for families fleeing from domestic violence and just other things, I think, broadly as well?
No, and it's a great point. I didn't get to the housing issue in my earlier answer, but Kevin, the rescue plan helped on the housing front a great deal, especially on the eviction challenge within the broader challenge of housing, just preventing people from being thrown on the street, being thrown out of their homes out on the street, was the biggest investment by far in American history in preventing evictions. But here's the big cautionary tale. We did not get done either the extension of the child tax credit into 2022 or additional investments in housing that would have come if we had passed Build Back Better. So we failed, and I'm perfectly willing to admit that. I'll mention for the record, though, that the other side provided zero help on the rescue plan and zero help on any version of Build Back Better. But we have to take responsibility for our failure for not getting the Build Back Better legislation done. But we're going to keep at that. We're going to figure out a way to make these investments in housing and other priorities. And so my point is that we need additional support, additional legislation, some version of what was called Build Back Better. We don't know if it will still be named that down the road, but that additional investment would make it possible to have more investment in housing, so you can meet the needs that your questioner asked about Section 8.
Yeah, and I think that when we think about those types of supports, and you talked about this a little bit, we also have to get families to a sustainability where they're not relying on that Section 8 voucher or those other supports. When I think about the community, I live in one of the poorest parts of Lancaster County here, by census tract and those things, and some of my neighbors have, over the last 2 years, they're no longer my neighbors. Why? Because my neighborhood's getting gentrified. Well, where do those individuals go? Right? My neighborhood was a poor neighborhood. Now it's not as poor as it used to be.
Yeah.
And so, the mobility of people needs to be one of personal agency, right? I'm choosing to move from this community to that community, not I'm being forced to move from this community to that community, or the community I have no choice to live in is subpar, substandard housing, which I think we all know that not necessarily even saying most, but too many of those Section 8 vouching holding individual property owners just aren't providing adequate housing. I think when we think about that, we've got to figure out a way to have increased requirements of quality of life, not just accessibility to a roof over your head. A roof with leaks doesn't do you a whole lot of good, right? So just, I think it's a great question. I do want to hop back here to mental health. One of the individuals in the chat here talked about having a family member who is in law enforcement, says often comments how helpless his team can feel when they enter a situation where someone has had a mental health break. We cannot rely on law enforcement to be social workers, healthcare workers, and behavioral health coordinators. Think of how the burnout can then happen with a heavy burden. We've talked, you and I have been in panel before with a law enforcement officer who talks about this very thing. I think it's important that people know when I get questions about the HELP Act, Senator, I'm often asked, well, that sounds like law enforcement would be mad about that, right? I think the Fraternal Order of the Police even supported your bill. Is that correct?
We worked with the FOP, and probably the best voice for this, at least in Pennsylvania, in terms of what in my experience, has been a Pittsburgh police officer, Lieutenant Eric Kroll. He met with us innumerable times, and he appeared on calls like this, and he said that having a community mental health therapist available to work with a person who's having a crisis is always preferable to sending out an officer alone. So police departments and police officers have been, in one way or another, calling for this kind of help for a long time, and no one was there to answer their call in that sense. We weren't willing to have these conversations. And look, like any piece of legislation, you have to bring in the point of view of a lot of different folks. I also want to make sure that Michael, Ben and Michael from our team, I don't know if there's anybody else, I just see.
Yeah, I see Michael.
Michael has a long history, many years of history of working in the disability community. I'm not sure there's anyone who knows more about disability policy in the United States Senate. I mean, senators or staff combined. But Michael, what's your experience with this, not just the issue generally, but in particular with regard to the interaction with law enforcement on the bill?
I think exactly like you're saying, Senator. What you need is the referral that 211 does, but then you absolutely have to have the services to back it up, both the acute ones in the time of the crisis, but then the ongoing ones as well. You're a co-sponsor on Senator Wyden's Cahoots bill, which would expand the ability to have crisis teams be able to go out to a family or an individual who's having a mental health crisis and immediately, with or without law enforcement, depending on what's needed, address that need. And then we're building out the long-term community mental health services as well. So all three of those things have to be in place.
Yep.
Yeah, thanks, Michael. You know, we had here, and I've always, Michael is the reason I know you at all, Senator, so I'm always grateful to see Michael's face. We had first talked about those issues, and that was my entry into working with your team. And, you know, the Lancaster, I'll say that our city police here have actually added social workers as part of their ranks, and that's been
great.
Really valuable and important. Not enough, right? Nothing is ever enough, so we can keep moving. Never celebrate until victory is won for all.
Yep.
But that has been a good part of the work that we've seen here. And so I encourage any way that we can sort of try to make that standard expectations is important. I want to, and also, you know, here, you know, in our community, we had a tragic, as you know, because I've told you this story, Ricardo Munoz was killed by a police officer when he came, it was a mental health break. And at the time I had an intern, an MSW intern, and he was really distraught by it. And he said to me, it's just frustrating to know that I can go into a neighborhood and a situation with a clipboard and no one gets killed. And sometimes when law officers show up, someone gets killed. And we weren't disparaging law officers. It was the wrong resources gone. And that's what 211 is trying to be a part of there. I do have a question. You had talked about the child tax credit, and there's a question here asking about the lapse in it. It reduced child poverty by 40% and went away. Do you have a sense of any chances of that coming back being permanent? Is that going to be something that's going to be pushed for as you go back to Build Back Better or something else?
We got to keep at it. I meant to use this word before, and I don't think it's an overstatement. That was a tragedy. When you have a policy that for the first time in American history, this has never happened before, that we reduce child poverty by 40% just because of one policy in 1 year. And then you say, let's not do it again. That is what's called an American tragedy. And we've got to keep fighting to get, and you know what? Some people said, oh, well, then you weren't really providing enough funding for long-term funding. Well, damn it, if it requires another 300 billion or 400 billion or 700 billion, we got to do it, because nothing we could do, or very few things we could do in the next 10 years would be as important as this. So we have to keep fighting. Look, there's consensus on our side, except for one senator who has raised questions about it, but has not raised questions about the investment itself. It's just about the number of years and what some of the requirements. So if we can work through that, and believe me, there's an awful lot of engagement to get his support. But look, maybe there's a way, and this sounds like a you know, throwing a 70-yard pass and hope someone catches it, but maybe it's getting a little better. There might be a Republican senator or two that we have not engaged enough. In fact, I had a conversation the other day with a Democratic senator who had talked to a Republican, and I won't use names because I'll get them all in trouble, who thinks there might be the potential there to get some support on that side. Because look, this policy generally has been bipartisan. The child tax credit has been bipartisan. What was not bipartisan was our great enhancement of it or expansion of it. But if we can get a Republican to go along with us and we can't get an agreement with one Democratic senator, I don't care how we get to 51 votes, we'll get there any way we can.
Oh, right. I mean, you're all Americans, right? You're not just Pennsylvania. You're not just a Pennsylvanian. You're an American. And so hopefully, I mean, today, one of the things I'm proud of, Senators, we've got you leading off our day. We have Speaker of the House of the Pennsylvania Representatives, Brian Cutler, is in our 10 o'clock session, and he's side by side with City Council President, very well-known liberal in Lancaster, Ismail Smith Wade out, right? They're in the same room. I've had conversations with Representative Sterla and Representative Cutler in the same room. We've got to find a way to get people at the table and to remember the reason you're there is the people. The reason you are not there is your party.